I want to welcome everyone today to the very first inaugural episode of Advocacy in Action. It is the official podcast for the Smart Health Benefits Association. I'm Caroline Egan, president for SHBA, as we affectionately call it. And we're not just here to read the news, are we, Robin? We are here to help you speak on behalf of employer plan sponsors, stay ahead of the legislative curve, and bring a unique boots on the ground perspective to the policy table. Our real goal is to help design the best policies to support the modernization of our healthcare and financial systems for all Canadians. But before we dive in, I figure let's get the audience to know us a little bit. So, Robin, tell us a little about your background.
Well, Caroline, first of all, I wanted to say thank you for asking me to co-host this podcast. I couldn't be more excited. And you and I, we figured out we've known each other close to 30 years, which, I was talking to someone recently about when I first started going to see my barber, my hair was dark brown when I would look down, and now it's gray. So, you and I have been around a long time and we've seen a lot of things. And I think in the last couple of years, I've just been so excited about what I've seen with the SHBA, the Benefits Alliance. I think there's a lot of great stuff for us to talk about. There's some great guests that we can have on. For a bit of my background, I started with London Life way back in the day in 1996. My dad has always been in the business. Great story. Immigrant to Canada. Him and mom started with nothing and grew this practice. And I'm really proud to be a second generation advisor. I am managing partner currently at ARIA Benefits. I have two business partners that run the individual side of our business. But I'm really excited, Caroline, because we never could have predicted we'd be sitting here 29 years later, podcasting, co-hosting together. And I'm just so excited to get this rolling.
Yeah, I absolutely love it. And Robin, you hit the nail on the head why I thought of you to co-host with me is that you, along with your dad, learning as a young man, and then here you are today, 30 years later, running a practice. And while I've never been an advisor myself, I've always had the passion to help people grow and support advisors with their clients. And now we've really touched on what has become a true passion of mine, and that's advocacy and really helping to build Smart Health Benefits Association with growth and really doing meaningful work and filling that void in the industry as to the voice that did not exist before. So with that said, I'm really excited to bring in our two guests. There's two better people to kick off this first episode with us than bringing in the chair of the board for Smart Health Benefits Association and our chair of the Advocacy Committee. So let's meet, first off, Chair of the Board, Gary Walters. Tell us a little bit about yourself and your background.
Hi, Caroline. Hi, Robin. It's great to be here, and SHBA has been something we've been working on together for, certainly Caroline and I, for actually 2 years now. So it's exciting to be here. I'm an actuary by training. I hope you'll all forgive me for that. But I've been in the group benefits space for close to 40 years now, working for insurer, a reinsurer, being a consultant as an actuary to both insurers, pharma companies, and provincial and federal government, and currently working for a large TPA where we obviously as a TPA have strong connections to providing benefits, both as an administrator and advisor. So this is right where I want to be.
Excellent. Well, welcome, Gary. And we've got Todd Stephen, who's the chair of our Advocacy Committee. Todd, tell us a bit about your background and why you selected to be part of SHBA and fill this leadership role in the Advocacy Committee.
Yeah, thank you, Caroline and Robin, for having us on today. My background, extends a very similar number of years to Gary's, both in the industry and working with plan sponsors and plan members in building and managing benefit programs. The last 30 years as a independent advisor and consultant. I've, like you, Caroline, certainly found my passion and not only wanting to create kind of better outcomes, best outcomes for our clients, but also to fill a void in the industry and advocating for those same constituents. And It's been fascinating working with you and the precursor to what's now the Smart Health Benefit Association. All the people that have been involved in that are still involved in that. In realizing that our voice is not just being accepted, but it's being sought out. And so I'm very, very excited to be part of this organization, to be part of getting it off the ground, and really happy to be here today.
Well, that's great, Todd. Thank you for sharing that background. And then I've also seen your passion and involvement in what we've done to date, and really excited to see how we have organized ourselves and grown. But as we dive in further, Robin, I was thinking about, when it comes to the provincial and federal policies that do touch group benefits and savings plans, what do you think is the biggest risk that an advisor would face walking into a meeting with one of your clients, one of your business owner employers?
Yeah, it's a great question, Caroline. And really, I think the biggest risk is being caught flat footed, right? You can walk in a renewal, you're feeling really well prepared, you know the claims experience, you know your renewal numbers, you've got the plan design conversation ready to go, and then leadership, whether it's the CFO, the chief people officer, the CHRO, brings up something completely different. Maybe national pharmacare, maybe it's Alberta Bill 11, which we're going to be talking about in a subsequent episode, maybe another policy change that's suddenly in the news, and ask, okay, what does this mean for our business and our people? And in that moment, the advisor has to be able to connect the dots, because saying, well, we're just going to wait and see what happens, that doesn't cut it anymore. I think clients are looking at us to interpret what's happening at the policy level and translate that into practical advice for the employer, the plan sponsor, and ultimately those employees and families that we look after. So to me, that's the blind side. It's not just knowing the benefits, it's understanding how policy, legislation, healthcare, pharmacy, mental health, financial wellness, even all of these things to intersect with the advice that we give every day.
That's great. And our goal at the Smart Health Benefits Association is really to help, educate not only advisors, but policymakers, right, about this viewpoint that is very unique in the industry. We're different than the carriers. We're different than pharma. We've got that unique perspective. And, so I think I want to come over to Gary and say, a lot of independent advisors do assume that because insurance carriers and pharma companies have massive government relations teams, that the industry's advocacy and education is fully handled. But why would you say relying solely on those standard industry updates leave an advisor without the full picture, or even an employer?
Okay, certainly, Caroline. I mean, the pharma companies and carriers are very knowledgeable, but we know that external parties I don't know, they just see them as advocating on behalf of their members to the benefit of their industry, even if they are actually trying to explain something about how our healthcare system could be improved. They're still just seen as self-serving, I think, by most of the public. And so, it's important that there is somebody who's talking about that who isn't seen as being self-serving, and that's what we're trying to provide there. We felt that Canadians with private coverage, who are a silent and large majority of Canadians, actually need a voice. And who better to provide that voice than the advisors? They're the people who sit across the table from plan sponsors every day, working to create plans that work for all members and their employees. So, in short, SHBA is not here to advocate on behalf of advisors, but it's to use the advisor's experience, what they learn every day talking to those decision makers, and bring that into public policy, industry policy, and to ensure that decision makers, and this is both, or policymakers maybe better, understand how private plans work and the impact of their decisions on plan sponsors and plan members. Something which is important because as a silent majority, by nature, they're not strong advocates. And I think it's easy to get focused on the small percentage of people for whom the current system doesn't work as well, rather than the large majority for which it's actually working pretty well. And people have recognized this independent voice. When SHBA appeared before the House of Commons committee studying national pharmacare, and again when we talked to Health Canada regarding national pharmacare, and as you'll hear a little bit later when we talk to those in Alberta tasked with implementing Bill 11, policymakers keep saying to us directly, we hear from system providers, but we haven't heard this perspective before, which, given that it's most people, is really surprising, disappointing, and the space we want to fill. It's that danger that if everybody relies only on the carrier's perspective, then there's a nuance that gets missed, because by nature the carriers are looking after the carriers. And again, if a policymaker only relies on the CLHIA to represent private plan members and plan sponsors, then they're going to likely just discount ideas, often interpreting them as self-serving, which could make our healthcare system better for all Canadians.
Gary, I think you've made a really important distinction here in this, and I'm glad we're recording this, because this isn't about being opposed to carriers or pharma or any other major stakeholders, right? Like, they're critical partners in the system, and in many cases, our interests are very aligned with them. But what I think I hear you saying is the SHBA brings a different lens to the table. Like, we're representing what advisors are hearing directly from employers, from plan sponsors, and from the people who are trying to make these programs work inside real business every day. So we're not replacing anyone's voice, in my mind. We're completing the picture. We're helping policy members understand what the impact looks like at the employer and employee level, which I think is incredibly important.
No, you're right, Robin. However, there will be situations where maybe our interests or the interests of plan sponsors and plan members aren't aligned with carriers. So our intention is to maintain an independent voice and be flexible, working with different allies as appropriate on each topic. But most importantly, the overall view is we want to be at the table to help educate and design policies that support the physical, mental, and financial health of Canadians. In fact, SHBA's vision is very broad, and I quote, "Everyone in Canada deserves access to support their physical, mental, and financial well-being, no matter where they live or what coverage they have." Through the member companies of SHBA, we represent somewhere around 10 million Canadians through 65,000 employers. And, the carrier's voice is important for the system, but everybody needs SHBA's voice to speak on behalf of plan sponsors and plan members, the parties for whom the whole system is due to work. And our feeling is that SHBA can bring a perspective and solutions without the perceived bias that carriers and farmers are seen to bring. We want to influence public policy, industry policy, but also bring you, the advisor, an informed and unbiased perspective. I think, Robin, that's the point. We are a party to this, and we are that different viewpoint.
Yeah, absolutely. Todd, I want to bring you into this because this is where the idea has to become practical. It's one of the thing to say, we have a unique voice, and I think all of our listeners would agree with that. But the real question is, how do we organize that voice in a way that governments actually hear it and pay attention? You are chairing the advocacy committee. You're also an advisor yourself, similar background to myself. So that was really interesting to learn this morning. So you understand both sides of this, right? So how is the SHBA taking what advisors are seeing on the ground and turning that into something structured, credible, and actually useful for Ottawa and the provinces?
Yeah, question. And that's where we spent a fair amount of kind of mental bandwidth trying to get our structure right so that we could do exactly that, is have conduits to identify issues that either are coming out of policymakers or coming up through the grassroots advisors, and organize those issues in a way that we could actually make progress and move them ahead. So we chose an approach where we formed 5 working groups by, we'll call them, subject matter experts. at least loosely subject matter in. And I think you mentioned them earlier: insurance, mental health, drug and pharma, financial wellness, and then healthcare, with the expectation that we'll have a lot of issues that have overlap among those. And between those working groups, we have over 50 volunteers that are forming those working groups, with people who have volunteered and stepped up as chairs and co-chairs. And it's a very dynamic and interactive design whereby issues can come from anywhere. They find a home in one of those working groups, either that initiated there or directed there, and then we're starting to build out a process whereby those working groups start to build structure around that issue, and where do we feel the plan sponsor is best represented in that space, and then there's an iterative process by which we kind of land on not only the issues that we want to take on in our positions, but also what our work plan is to try to move those issues forward. And the the strongest, I guess, message or culture that has started to develop, and Gary referred to it, is that it be in the best interest of that plan sponsor and plan member. And we're working collaboratively with other stakeholders, be it the insurers and CLHIA, be it pharma, be it different stakeholder organizations. I'm also really happy to report that we've got some, because this isn't our home base, we're all learning a little bit about this advocacy and government relations area as we go. We've been able to attract some really powerful and amazing skill sets and people that do know that space well. So while we're, some of us who have lived primarily in a different world are not kind of second nature to being in this position. We do have some great volunteers that have been curated through Caroline and through others to make sure that we're going to be able to effectively advocate in the areas that we choose.
Yeah, it's been, I have to say, it's been really amazing to see the structure come to life with those 5 working groups, and then witness so early in the process what that collaboration looks like. And sometimes these policies will be announced, right? We saw with Alberta Bill 11, and it was really amazing to see the result of that collaboration and getting to the table with Alberta Health and having a conversation, even though it's announced of what's happening, that having that recognition and invitation to join their working group. Because right away they did say, gosh, we really wish we had met you a few months ago, right? Because not that we want to, necessarily change something. There's nothing to change. It's happening. But what we can do is help them understand the process and what it takes for an advisor sitting across or beside a business owner looking to, what will this mean for their renewal? So we're going to get into that in the second episode. So I'll plant the seed there for our listeners that we're going to take a bit of a deeper dive on Alberta Bill 11, but just simply to say, for the second time, 2 out of 2 times at the plate, that we've had that recognition in our voice being unique and valued and being invited back to the table.
Sometimes I think we underestimate our voice, which is, I think typical of people in organizations that are, have their heads down and are just trying to do good work, about, what the value of their knowledge and perspective and skills actually are. And when we were, as Caroline mentioned, invited, into a deeper kind of relationship regarding national pharmacare, and now a deeper relationship regarding the Alberta Bill 11, there's a tendency to go, oh, I guess I assume that, all organizations are received this way. And that is, from people in the know in this space, is the exact opposite of what normally happens. And that, I think, goes to what Gary was referencing earlier in terms of our very focused viewpoint on bringing our perspective, bringing our stories and our experience with a very purposeful intent to represent the plan sponsors and Canadians in this journey for better outcomes, better health outcomes relating to their own journeys and how these plans support those. So, yeah, it's been interesting and surprising and refreshing, and it's giving us the energy to continue to push on as a bunch of people with full-time jobs and volunteering their time to make these programs better and more effective.
Gary and Todd, I really appreciate you joining us today because I think there's some real key takeaways here for advisors. This kind of insight that we're talking about, I think it changes the conversation with clients. It helps you walk into that renewal meeting with not just numbers, but with actual context. You can explain what's changing, why it matters, how the SHBA is helping make sure the advisor and plan sponsor perspective is actually being heard. And I think what that does is it moves us from being seen as vendors to being seen as strategic partners, which, I'm sure you both had clients call you a partner, and it's one of the biggest compliments we can get. And I think this puts us on that path to becoming even more of a strategic partner and helping people going forward.
Yeah. Yeah, Robin, I was thinking, so many times in the last sort of 30 years, I'm sure we've been at, many conferences together or sitting somewhere, and there's a hot topic, right? There's a hot topic of what's happening. And advisors will often say, someone should do something about that. And so now here we are. The cost of being a bystander is too high. And I would challenge anyone listening to us today, if you're an advisor listening to this now, you should tap the link in the show notes and join the Smart Health Benefits Association membership. Trust me, the investment is a fraction of the value you can bring your clients when you're fully informed, and that is our goal. So I would say subscribe to Advocacy in Action today and come check out episode number 2. We're going to have Tim Clark. He's the chair of our healthcare working group, and he's going to kick off an episode with us dedicated to Alberta Bill 11. We're going to do a series on it because there's a lot to unpack there. And so we'll give very high level details for advisors, for plan sponsors, employers. And I want to say thank you for tuning in and welcome to the new voice of the industry.